Hello everyone, my name is Clarissa and this is DNP Mentor. I have been a nurse practitioner since 1998 and I do have a doctorate degree in nursing practice. I have both specialties certifications in family practice and as a mental health nurse practitioner. Now in this channel, my focus will be on providing education and information on mental illness. I plan to mentor not only nurses that are new and nursing students, but also individuals that might treat or suffer with mental illness. I do have a specialty in that I provide depression care on a full-time basis. And with that introduction, let's go ahead and get started with today's topic. The topic that I chose for today is if medications are needed to treat clinical depression. Now, there isn't a one answer response that I can give you because it is no different than if we were to ask, do you need to treat hypertension or diabetes with medications? It's going to really depend on the severity of the illness. Now, you might recall from my first video presentation where I go into detail as to the illness of depression and that in fact it is a medical biological problem. And so you would all agree that the brain is an organ just like any other organ. And so it's susceptible to areas of the brain not to do its job. And so with clinical depression, there's a component of that. And so depending on the severity of the depression, medications might be indicated. Now, are medications needed for everybody with depression? The simple answer would be no, but it would depend. Now, it isn't a choice by the individual whether or not medications are indicated. Certainly they have a choice, but just like with any other illness, it is the severity of the illness that will dictate whether or not medications are indicated. So let me give you an example in another illness that's not depression, just to make it a little bit more clear. So if somebody has high blood pressure or diabetes, certainly they can be treated with lifestyle modifications such as diet and an exercise plan. Now, there are a lot of people that are indeed controlled with these lifestyle changes and they don't require medications. Similarly, with depression, there are lifestyle modifications that do work in the treatment of clinical depression. And it's usually lifestyle modifications that help to release endorphins. A good example of this would be exercise. If you have clinical depression and you do not have an exercise plan or program, you're missing out on a very effective treatment that can help with that. Now, would this alone be enough to treat your depression? Again, it's going to depend on the severity of the illness. Remember that when we say exercise, it's not just about physical activity. I have people that come into my office and they will show me their Apple Watches and they'll say, look, Clarissa, I walked 5 miles today at work. And these are people that have jobs that require a lot of physical activity, a lot of exertion. And so, but yet they're still depressed. And so physical activity in this case is not enough. I still tell them, go and walk. And they tell me, but wait a minute, if I've already walked for 5 miles. The interesting thing about the brain is that it knows if the physical activity, the exercise is for self-care or if it's related to a chore. Think about this. If I'm at work and I have to run upstairs to go get something, come back down, or go work on this piece, go do that, go do this, I'm not allowing my mind to rest. I'm focusing on a task. I'm focusing on a chore. Yes, my body is moving, but my brain and my body, they're not connected to generate any kind of piece or to really have a sense in whether or not the endorphins are going to be released. And the brain knows. And so if you want to have the endorphins released with exercise, it has to be a separate thing, a certain physical activity. Could it be dance? Could it be not necessarily involving a gym? Absolutely. It could be skipping, jumping jacks, anything like that that is indeed exercise or a physical activity, but it has to be related solely for the purpose of self-care. Now, during these COVID situations, there are individuals that come in for treatment for depression that have been controlled with lifestyle modifications. So these are people that are very active, that have hobbies outside, that go hiking, that go to a gym, that socialize with friends. And all of that generates endorphins will keep sort of like that clinical depression at bay. They still have it, but it's controlled with that type of treatment. Now, when COVID happened, all of these activities came to a halt. And so now the things that were helping them, these lifestyle modifications that were helping them, are no longer possible. And so now they come in, and maybe for them at this time, medications might be indicated because the other things are not available. Now, let me give you another example of this. I've treated patients where, for one reason or another, they could not engage in physical exercise. An example of this, I had a young mom that, and very, very educated in terms of depression, what helps, what didn't. She had done a lot of research, had been in treatment before, had been through counseling, so very, very educated. And so she came in and she told me what medication works for her based on her past history. And she mentioned to me, I have not been on this medication for 3 years, but it worked. And that's because her treatment of choice was hot yoga, and she needed to do this 2 hours daily. So her routine was 2 hours of hot yoga, 6 days a week, and that kept the depression stable. Now, she had had a second child, and the baby was about 2 weeks old. And so it was impossible with an infant and another child at home for her to be able to go into a hot yoga studio to exercise. And so she said, I'm going to need to be on medication probably for about a year. And so we went through her history. It was appropriate, the medication she was requesting. So certainly. And yes, about 10 months, it was less than a year, she came in and we actually tapered her off the medication, and she no longer required it because she was able to go back to the routine where she was able to generate endorphins that treated her depression. And so similarly, depending on the level of depression, lifestyle changes might be enough. Now, there are people that will also come in for an evaluation, and these are individuals that have tried not to be on medication. They have done everything possible. They have exercise, they know about triggers, they know about toxic people, they know about negative distorted thoughts, they know about coping skills, they know about limiting their alcohol, because for some people that's a depressant, and so the list might go on and on. And they might even be engaged with a therapist once a month or once a week. And it hasn't been enough. And these are people that will come in to tell me there is no reason why I'm still depressed when I am doing all these things that people tell me to do, but it isn't enough. And so for them, the severity of their illness is to the moderate or more severe versus a more milder version. Now think about any medical problem. There's a spectrum from mild to severe. Not everybody with diabetes is at the same level, or everybody with high blood pressure, or everybody that has had a stroke is exactly the same. It's all very different. It's all very individual. The same thing is for anxiety and depression, and really any other mental illness. So if you could understand this concept, then maybe it might help you to make the decision of taking medications. Now, if you're not doing any of the lifestyle modifications and you just want to come in for medications, they're not going to be as effective because they're not magic pills. They're part of a treatment. Think about if a diabetic that now requires medications, they might need 1, 2, 3, they might even be on insulin. Now, do they stop the diet and the exercise? No. If they do, their illness is not going to be as controlled. It's going to be better on medications if they didn't take it, but it's not going to be where it should be. Similarly is the treatment and the medications that are called for depression and anxiety. I hope that makes sense and you can understand this concept a little bit more. Now, there is a lot of stigma, not only with having a diagnosis of anxiety or depression, but there's also stigma, now I need medications. Now I'm going to become addicted. The treatment medications for depression are 100% not addictive. Now, yes, there is a weaning off process, just like we start it slowly. And the reason why we start it slowly is to minimize any side effects, because we are introducing something that the body doesn't recognize, that the body doesn't know. And so we introduce it slowly. And the way we stop medication is really the same way that we start it. We start it slow, and when we discontinue it, we taper it off in a similar way. And so this will prevent any problems, because again, when we're taking off the medication, we are also creating another change. Now the brain is used to sort of having the chemistry regulated on its own. So now we're taking that away, and we should take it away slowly. Another aspect to consider is that stigma to mental illness is also something that we can sort of dismiss ourselves personally if we educate ourselves as to what mental illness or what depression or what the illness of anxiety is. And so we know now that yes, it's a medical illness. I didn't choose it. There's nothing that I did. I'm not weak. I don't have poor character. I don't have enough faith. I didn't choose this. I didn't choose it. Just like individuals don't choose cancer. Now, I had a patient not that long ago that told me, I think I'd rather have cancer than a clinical depression. And I said, why is that? And they said, well, when you tell people that you have cancer, there's compassion, there's understanding, there's caring. When you tell somebody, especially in certain cultures, I have depression, it's like, oh, you're weak, or snap out of it, or do this, or do that, or you're not trying hard enough. Who wouldn't try? Who wants to be depressed? Who wants to not enjoy life? How is that even a choice? How is having cancer a choice? How is having high blood pressure, diabetes a choice? It isn't a choice. Mental illness, depression, anxiety, it's an illness, and we do not choose it. A little bit of bad luck, perhaps, yes. A lot of it, it's a genetic component, just like any other illness. Now, I'm going to go ahead and start recording a part 2 of medication teaching. I hope that you will also watch that. I will put it out on Monday, and then after that, I'm planning on recording and releasing videos once a week on Monday. So I would appreciate your comments. And if you have any suggestions or anything that you specifically want to learn about mental illness, I will look forward to reading that in your comments. I hope that you take the time to like and subscribe to my channel. Thank you for your time and have a wonderful day.